My name's Omar Corshad. I'm the President of the Australian Medical Association, and I've come up to Queensland this week to talk to doctors and to talk to communities in North Queensland about the Queensland Government's outrageous pharmacy prescribing pilot. This is a pilot program in name only, but a significant change to the delivery of primary care in North Queensland that would allow pharmacists with just 3 weeks of online training to undertake diagnosis, management, prescription and dispensing of drugs for 23 different conditions, complex medical conditions that are of course very high in prevalence in the North Queensland community. This is outrageous because it puts patient safety at risk, all in the name of protecting the business interests of the few wealthy people who are lucky enough to own community pharmacies in North Queensland.
The North Queensland Pharmacy Scope of Practice trial, which I understand is the full title of that particular trial, first came to my attention earlier this year. We had received word of this trial and that Yarrabah was one of the proposed sites. Initially, I was a bit intrigued to know what it might look like. I was aware of this other trial that had been going on since the 2021 with urinary tract infections, but this was really a huge step up from that when I first saw the outlines. And the documents that followed in draft form, obviously, originally, showed that an increase of scope of practice beyond the current scope of practice for pharmacists in North Queensland to diagnose, to treat, to prescribe and dispense on a list of about 23 medical issues that we see every day, along with a whole host of other problems. And I think that's an important point to make. Heart failure, diabetes, hypertension, hypercholesterolemia, sore throats, skin sores. All of these problems are essentially what we deal with every day, but in isolation they might be a simple fix. What I was worried about was the lack of connection between these problems and what lies between those gaps, like kidney disease, like rheumatic heart disease, like ischemic heart disease. These are major problems for Aboriginal Australia. As a community-controlled health service, we weren't being asked about this for our own community. And Queensland has done fantastic work around health equity reform, and they continue to strive towards health equity reform in the health system. This, though, sits outside of that, oddly, because it doesn't have community consultation. It doesn't ask the community what it needs. It takes the interests of private business owners and a notion of what they feel is their scope of practice and sits it outside the existing models of care that are working for communities. I think workforce shortage is a very complicated problem. I think trying to plug it with a single scope of practice is not the way to go, in particular when you're talking about Aboriginal communities, where we know a broad team-based approach is the gold standard for care for Aboriginal people within their communities. Here at Gurriny Yealamucka, we have a team-based approach to healthcare. We have health workers who come from the community, Aboriginal health workers. We have nurses, we have doctors, other allied health staff such as diabetes educators, physiotherapists, podiatrists, etc., all working around a patient. We also have a pharmacist within our team who's been working within the community of Yarrabah for over a decade now, and they work within the broad primary health team. They are integral to making sure that we have medication safety.